Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. College is full of exciting new things, from meeting people to living away from home, but college can also be stressful as a high school graduate tries to develop new routines, live on a limited budget, and manage responsibilities all on their own. It can be scary for college freshmen as well as their parents. Joining me now with some tips and information on how to stay safe and healthy in college is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in. So as we're in the graduation season, as we were talking about, what can parents do and their kids do to prepare for college?
Well, I think as far as their health, most people are healthy at that age, unless they have a chronic condition. In that case, it's different. But most young people are healthy, and their main challenges are going to be, as you mentioned, managing their health independently. So that means doing the preventive things that will keep them well, such as eating properly, getting good rest, and not doing any high-risk behaviors. So those are the things where parents can help them prepare and intervene if necessary.
Now, before we send our kids off to college, what would you recommend for parents to do? Go, like before school, they go and get a physical, different tests?
Most colleges recommend that you have a physical anyway, and then get your immunizations updated if you need that. A reasonable thing to do would be also to have your vision checked, make sure that's okay, and then just some routine blood tests if that's appropriate for your child, and making sure that they're healthy before they go and that they have appropriate medications to take along with them, even if it's a bottle of Tylenol, to make sure that they have something in case they get a headache.
Now, what are some common health problems at college?
Well, again, generally the kids are healthy, but they will come down with flus and colds because of sleep deprivation, not getting enough rest. Commonly also, their routines are a little bit up to them now, and so they may not be staying on top of their diet as well as exercise and gain weight.
Okay. Now, are regular checkups recommended while a kid is in school and college?
Not necessarily. I think if they have a checkup before they go, and maybe again once a year after that, it's fine. If they have an ongoing health condition, of course they should hook up with their health service there. Okay. Now,
we were talking last week as we were preparing for this, that good health in college includes making sure to safeguard your kids, and also the graduates out there that are listening to this, to safeguard themselves from STDs, which are so prevalent these days. We've done stories on that. So what would you recommend?
Yeah, well, I think date rape and STDs and unwanted pregnancy would be the top three. And I think awareness is the first most important thing. Many young people think it can't happen to them, but they should be aware it can. So awareness would be first. Safe sex would be very important, bringing condoms and all of that, and just being very careful.
Okay. Now, students will be maybe working and going to school at the same time, and you talked a little bit about having to manage these new schedules, and so a lot of times we hear in college that the kids are fighting sleep deprivation, staying up late from exams, partying, things like that, having to get up early for classes. So what would you recommend for college kids who have sleep deprivation or fatigue?
I think keeping their priorities straight is pretty important, and planning in advance to study in advance, not cram at the last minute. Maybe planning a schedule in advance so that they can program their day. I think there's a great temptation to stay up late and then try to get up early, and that usually doesn't end up helping anybody.
Okay. Now, how much physical activity should a student get while they're in college?
I think they should exercise pretty much daily. 30 minutes every day is not a lot to ask, even if it's a brisk walk or a bike ride. And that'll help them stay healthy both mentally and physically.
So they can maybe do that as they're walking to classes or things like that.
Sure.
All right, and before we head to the break, what can college students do to maintain mental health? I mean, it's always important for physical health, but it can be pretty daunting. You're not having your family around maybe, things like that. So what can a college student do to prepare mentally and to keep that good mental health throughout college?
I think developing a strong support system, both at college and away, knowing that they can pick up the phone and talk honestly with their parents about what's going on is really, really important. Not trying to put on a brave face and pretending everything's perfect if their grades, for example, are not very good. And then support system when they get to college, developing friendships, joining clubs and so on, where they can feel that there are people to talk to. There's always student mental health as well at colleges.
Okay, one last thing is, what would you recommend for the parents out there? They're dealing with the empty nest syndrome, maybe. Yeah. And that's got to be difficult.
It's
for
very
parents
challenging,
too.
I think. Yeah, I think again, planning ahead, so knowing that transition is coming, and developing other hobbies, other things to focus on, so that they're not just at home worrying all the time.
All right, sounds good. Well, we will pick up our discussion on this topic after this short timeout. Stay with us.